Good evening, colleagues. Welcome to our monthly physician to physician talk with our county health officer, Dr. Geoffrey Leung. Dr. Leung has been very helpful and informative and has worked very hard to keep us updated. Take my opportunity to welcome him and please go ahead, Dr. Leung.
Thank you, Dr. Singhvi. So if it's okay, I can share just a few short updates and then we can jump
updates and
into
we'll go to question answer then.
Okay, perfect. So 5 updates. First of all, you may or may not have seen this, but OSHA, or the Occupational Safety and Health Administration, just put out a set of standards or emergency standards that apply to all employers with at least 100 employees across the US. So you probably heard this in the Biden plan weeks ago, but this is now coming to fruition. So employers with at least 100 employees by January 4th need to put into place a system where they're either verifying vaccination status or testing employees who have not been vaccinated. So that's a pretty big deal. It will apply theoretically to at least 85 million workers across the country. So that's one thing we wanted to make sure people were aware of. A second piece, just in terms of the overall numbers in Riverside County, we had been seeing a gradual decline in our case rate and positivity, as well as COVID hospitalizations for several weeks. But during the past week, we've seen a little bit of a slowdown and even a potential gentle bump. So our positivity rate is at about 5% right now. A week or two ago, it was around 4.5%. Our case rate has climbed a tiny bit from the 12 range to about 15 per 100,000 on a daily basis. And then our hospitalizations have also creeped up regarding COVID. We were in the 20s before, and we're now kind of in the 250, 260 range. So it's not long enough to call it a definite trend, but we want to sort of share with people that we're watching closely, and certainly as people move indoors with the cold weather and we move into the holidays, we were expecting a potential bump. A third update, we know that it's been all over the news, and this is before the pediatric vaccine portion, just in terms of boosters. If you count the number of permutations or kind of the different types of logic you would need to consider for each type of vaccine, whether it's a first dose, a second dose, an additional dose, a booster, there are actually at least 16 permutations that now apply to it. The complexity has increased exponentially. And as a reminder, Pfizer or Moderna, that meets one of those priority groups that we covered before. If it's at least 6 months after their second dose, they can receive Pfizer, Moderna, or Johnson & Johnson. And with Johnson & Johnson, if people have had a first dose and they're 18 or older, they at 2 months or after their first dose, they can receive Johnson & Johnson, Pfizer, or Moderna. So that's the mix and match. Kind of the next update, the pediatric vaccine, which is probably the biggest news. It's officially received the green light from both the FDA for emergency use authorization as well as the CDC. The CDC director signed off on it, and the Western States Committee also signed off on it yesterday. So that means we can all start giving the COVID, the Pfizer 5 to 11-year-old vaccine starting today. And then finally, there have been some questions on the Moderna vaccine for adolescents and children and what the anticipated timeline is for that. We do know that the FDA has essentially asked for some additional time to do that review. So we don't have any timeline. Just within this group, they want to take a closer look at the myocarditis part of the data. So those are the main updates that we have for today, and happy to jump into the questions whenever you like, Dr. Singhvi. Thank you.
Yes, thank you very much for the update. Very informative. Our first question is the county planning to host vaccination clinics for eligible children? Should we plan to refer patients to the county clinics or for MD offices who are not vaccination sites? where shall we refer patients?
So great question. So the first place we would recommend people take a look at is myturn.ca.gov. So MyTurn, of course, is the platform that California built to make it as easy as possible for residents in California to find and schedule COVID vaccine appointments. So that is up and running as of last night and is live today for including for the 5 to 11-year-old Pfizer vaccine. So myturn.ca.gov should have the most complete and comprehensive database. People can also reference the Riverside Public Health webpage. We do have 4 fixed sites that are starting the pediatric vaccine as of Saturday, this coming Saturday. Those include the Curve site in Riverside, the Temecula Promenade Mall, as well as the WIC sites in Indio and Lake Elsinore.
Yes, let me go to next question. Do we need to make a push to get more community-based clinics to be vaccination sites?
The short answer is yes. We can always use more community-based clinics, especially since medical homes are sort of the best, one of the best long-term and sustainable ways for continuing this effort, especially if we move into a scenario where we're having to do regular boosters or vaccines in the future. So absolutely.
Yes. Next one is: are there differences in long-haul effects for adults versus children? Anything we should be on the lookout for?
So, from what we've seen in the literature, I would say we don't know yet, and happy for anybody, to provide better or more up-to-date information than that. In turn, we want to be particularly mindful of any neurological or pulmonary side effects that we're seeing, and we do want to make sure that we're addressing it through, our primary care or specialty offices.
How about cardiovascular?
Yes, absolutely.
Next one, are there specific recommendations in treating patients with long-haul symptoms? Do we manage these patients in our clinics, or are there specialized clinics to treat these patients?
I think that we may have lost Dr. Leung. I know that I believe Dr. Shunlin Sang is on. Maybe she can pick up until he comes back.
Okay.
And
yes,
and Dr.
yes.
Singh, would you mind repeating the question?
Yes, I'll repeat the question. Thank you for taking over. And are there specific recommendations in treating patients with long-haul symptoms? Do we manage these patients in our clinics, or are there specialized clinics to treat these patients?
Here in Riverside County, we do have at Riverside University Health System Medical Center, our home clinic, our pulmonology clinic is seeing our long haul patients, and they are looking at those patients and following them forward. And if this committee or this group would like more information, I can pass on that information to this group to see how we could maybe accept some referrals. So there is locally, we are looking at long haul patients.
Thank you. Next question is: once vaccines are approved and rolled out for infants and above, what percentage of the population must be immune or vaccinated to achieve herd immunity?
I think that's a great question. And if anybody has a better answer than I do, one of the things that we're trying to figure out is what constitutes herd immunity for COVID. We know that different viruses or different diseases may require a higher vaccination rate in order to reach herd immunity. So at this point, we're not sure what exactly, what rate would be the magic number. But we do know the higher vaccination rate we have across the county, the better it would be for all of us to protect ourselves, because, again, this is such a new disease that we don't exactly know what threshold is to achieve herd immunity. Some people have said 70%, some people have said 80%. But again, I think the way we would like to message for now is to get as high of a vaccination rate as possible to make sure that everyone is protected.
So what's the level now? Do you have any idea roughly in US population?
Here in Riverside County, our 65 and over is actually quite high. For partially vaccinated, it's over 70%, which is wonderful, because we know that for our for our elderly patients, we know that that was a huge issue last winter, right? We saw a lot of devastating outcomes with our nursing home patients and our older patients. And so, we're very happy to say that currently in Riverside County, with our elderly patients, we are at a much higher level of over 70% for at least partially vaccinated and fully vaccinated. I'm going to pull up the numbers really quickly. If you can bear with me for 1 second. So 65 and over fully vaccinated is currently at 72%. Partially vaccinated is an additional, we're at 78%
Okay.
partially vaccinated. Mhm.
Demand for COVID-19 vaccine is increasing due to the approval of boosters. The EUA approval for Pfizer vaccine for children 5 plus. Do you foresee any problems with vaccine shortages in Riverside County? Do you have any comment as to vaccines going unused in Riverside County and needing to be destroyed?
I think right now we have a good supply of vaccine for children 5 and over. We've been planning for this for a little while. So, our vaccine team has done a good job making sure that anyone who is wanting to be a vaccinator of 5 and over have the adequate supply to do that. So no, at this time I'm not so much worried about having a vaccine shortage. Uh, Around 5 and over or for our 12 and over as well.
Great. Uh, what are you predicting for the flu season?
That's a great question. So right now, again, we are entering into flu season. We were just looking at flu data today, and we see that we are not in the thick of it yet. We are at the probably beginning stages of the flu season. We saw last year we had a milder flu season because of the masking and all of us doing the social distancing and staying indoors. My concern is that this year, because we are much more out and about, school is back in session, people are returning to some sort of normal interactions. We are anticipating that we will see more flu. We've already seen more RSV as a result compared to last season. So our recommendation is, again, to, if you can encourage all your patients to please get the flu vaccine. Flu vaccination, just like COVID vaccination, will help protect our patients.
Are you seeing patients with both the flu and COVID at this time? What are the recommendations when a patient presents with flu symptoms? Test for COVID or not?
I have not seen COVID and flu together yet, although we know that's coming, right? It's just a matter of time. The recommendation is that if a patient presents with flu-like symptoms or any kind of respiratory symptoms, we are recommending to test for flu and if you're suspecting flu and COVID, if you're suspecting COVID, some places have moved to dual testing. Some of you might have BioFire available as well. And so, depending on what you have available for your patients, it's not a bad idea to check for both, especially as we're moving into flu season. If it is flu, we could treat with, we have medications to treat, right? Versus, if it's distinguishing between flu and COVID would be a good idea.
Is there a specific uniform message we can be sharing within the medical community regarding vaccinations for both adults and children?
I think us as medical providers and, us being trusted messengers for our patients, right? They trust us, and which is why they come to us in the clinics. I think that we need to be thinking about, how we, if especially have patients who are hesitant, how can we take a little bit of extra time to convince those patients prior to going into this winter season. We've already seen, as you heard from Dr. Leung, a uptick in hospitalizations around COVID, and we're only in the first week of November, and we all remember last year. So, I think, as if we can spend just a little bit of extra time messaging with our patients who have not been vaccinated and sharing with them our thoughts around, how we could provide information if they have questions and, taking a little bit of extra time to answer those questions and try to persuade them to get vaccinated. I think the uniform message that we would like to provide as healthcare providers and trusted messengers is that we want you to get vaccinated. And we want you to get vaccinated now, in order to, be healthy and happy as we head into the holiday season.
So, do we have any idea about how many people have gotten flu vaccine, and what is likelihood that it will be effective? What percentage you expect that this will be effective this flu season, the vaccine?
Yeah, yeah, great question, Dr. Singhvi. So we do know, um, our EPI team today shared with us that our current vaccination rate for flu is 13.7% in the county. And that equates to about, I know Dr. Shivansi is on this call as well. I think it's 388,000 people in the county out of 2.5 million, right? And so, we have a long way to go. We can get that vaccination rate higher as well, so that I think both COVID and flu vaccines are going to be very important for us this season. We already have seen our first ICU admission for flu. And so we know that flu can have significant morbidity and mortality as well. And so, as we think about moving into the flu season and COVID, as we think about our ICUs and trying to spare our ICU capacity, that is something that, if we can push both flu and COVID vaccines this season, that would be great.
So, this patient which you have seen in ICU is COVID negative, I suppose.
That is our understanding at this time.
Okay, I'm done with my questions. Richard, you have any questions in chat box, please?
Yes, we do have a couple of questions. Thanks, Dr. Singhvi. The questions come up about variants. Are there any variants that are on the horizon? Any variants to be aware of? I know initially there was the talk of the Lambda and the Mu, but are we seeing that anywhere expanding?
And so I'm gonna start, and I think Dr. Leung might be back on the call, but not right now. Delta still continues to dominate. And so, that continues to be what we're watching. So no additional variants of concern in our county that, other than Delta at this time. I don't know if Dr. Leung wants to chime in and give any additional.
And thank you for jumping in. I guess I can only add that, we are aware that there are subvariants within Delta, but for practical purposes, we're not seeing any significant variants that would sort of impact the way that we need to think about things right now.
This new Pfizer is producing a vaccine currently. Is it having antibodies to the Delta variant, or is still the original Pfizer, which doesn't have, technically no antibodies to Delta variant?
So I think what we've seen from the studies is that in general, the vaccines are working for the Delta variant in creating an antibody response.
So the formulation is the same. There has been no change in the formulation.
Correct.
So you kind of answered part of this. So if someone had the Johnson & Johnson vaccine 6 months ago, can they take the full 2 doses of a Moderna or Pfizer vaccine?
So I think Dr. Sang was doing a much better job answering these questions than I would. But if someone has received Johnson & Johnson and now they need a booster at 2 months afterwards, they would get, if they wanted to get an mRNA vaccine, they would only get 1 dose of Pfizer or 1 dose of Moderna. They would not restart a new series.
Okay, can you comment on breakthrough infections?
So the breakthrough infections that we've seen have been, at a very low rate. For instance, if you look at our hospitalized individuals, about 90% of our hospitalized COVID individuals are previously unvaccinated. So about 10% of them, actually were vaccinated and would be considered post-vaccination infections. In the vast majority of those individuals, we're seeing that they have underlying medical conditions, or comorbidities that either may have made them more prone or less likely to have had a full immune response. So that's just in one particular grouping. If you look at sort of the general population and all cases, we do see that probably 80% of all the new cases are happening in previously unvaccinated individuals. So we still do have 15 to 20% happening in previously vaccinated individuals, and that would be sort of your breakthrough or your post-vaccination cases. I don't know, Dr. Sang, if you would add anything or correct anything there.
No, nothing to add. Thank you.
I did want to make note that Dr. Shavinsky did post a link for the long haul resources you might want to take a look at. The next question was for patients who did get the Johnson & Johnson, isn't it better for them to get a booster of Moderna at the 0.5 cc instead of the 0.25 cc since it's their first vaccination with Moderna?
So it's a good theoretical question, but it would not be consistent with the guidelines. And I do want to put in a plug for Dr. Shavinsky, who actually helped put together guidelines at the CDC, even regarding our long haulers. So I don't know if she wants to add anything right now.
I can. Hi. So I recently joined as a deputy public health officer as well with Riverside County. Just to go to the question about differences between children and adults with long haul. When I was there at CDC, we did find some differences. There was a little bit more of a predominance for children with abdominal pain and GI symptoms that were ongoing. But it's still not clear. There's also, some of the similarities we were seeing was still, the fatigue or the malaise, post-exertional malaise, which is one that sometimes can be missed, which is, after exertion, either mental or physical, that they then get very winded or very tired physically and mentally. They get the brain fog. So as they were getting older, older teenage years, symptoms more similar to what we would see in the adult population. But as you got younger, it was more abdominal related complaints, which maybe some just in general, kids not being able to identify what they're feeling, but just not feeling good. But I put a link in the chat for post-COVID guidance. It is focused within care is focused within primary care settings. So for children, maybe pediatrics, family medicine, adults, internal medicine, our primary care with and it gives guidance on when would be you might consider to refer out if there's particular diseases that you're identifying. It gives you a group of labs and assessments that you may do and resources. So if you and any kind of questions about that, I'm happy to respond.
I think we're just about out of time right now, but Dr. Shavinsky, can they contact you directly?
Sure.
Great. And then I believe Dr. Joe Lee's on the call. He'd asked if he could make a comment. I know he's doing some investigation looking at long haul syndrome. Dr. Lee, did you want to make a comment?
Yeah, can you hear me? Joseph Lee here. Hi, everyone, and thank you for Dr. Leung, Dr. Sang. I think the issue of the damage by the virus to the body is through the binding of the receptor, thromboxane receptor, which called thrombosis embolism, and then prostaglandin D2 receptor, which is very abundant in the organ like brain, the heart, the lung, the kidney, pancreas, and so forth. And unfortunately, the older one get, more prostaglandin D2 receptor is abundant, and that's what we call the immunosenescence. And there's a report recently talk about the children. In fact, younger children has less symptom than older children, even though the viral load is the same, and that because of the older children has both prostaglandin D2 receptor available to be attacked by the virus. So I think unfortunately, all the medication we have so far, there is nothing to block the receptor, only try to circumvent and prevent the replication of the virus in early stage. And so I think that's what the issue. So the younger children tend to have less symptom. And in fact, the report about 3 children in Southern California has a convulsion or psychiatric disorder, which is unusual. This is caused by the Delta strain. And so again, a lot of things we still don't understand, but then definite is based on the age, because the age is what we observe increase in the prostaglandin D2 receptor in the body, and that render the availability of the site to be attacked by the virus.
Joe, nice to hear from you. Any role of aspirin in that, blocking the receptors?
Well, aspirin, in fact, can block those, but it's not very effective. Very minimal. There are a lot of study in the lung in different places. In fact, the thrombosis embolism is caused by the thromboxane receptor being attacked by the binding by the virus. And that's why the virus is gone after the infection, but then the side effect linger on when the virus is gone because the receptor was bound. Yeah, and that's one of the issue we have, and should be tackled. And thank you very much to Dr. Leung and Dr. Sang and Dr. Singhvi and RCMA for arranging this kind of information, because they're very helpful.
Yes,
Thanks,
welcome, Dr. Swinsky and Dr. Sang and Dr. Leung. We have a very robust public health department, and you have been doing a great job. We thank you for that. So thank you very much, and please have a good evening.